start to speak.
Good afternoon. My name is Isabella Bosque, and my peers and I will be discussing the healthcare systems of North America. Next. More specifically, we will be answering the question, to what extent have the different healthcare systems of North America contribute to the quality of life of its citizens? We came to the conclusion that the healthcare systems of Canada and Mexico provide a better quality of life due to their universal system as compared to the United States, which focuses on privatized healthcare. Next. As stated, the United States uses a multi-payer private system. So this graph shows the sources of insurance coverage, and one can see that 55.3% of adult Americans rely on employer-sponsored insurances, which pretty much means that their workplace provides them with an insurance plan. The second highest percentage goes for uninsured Americans. Then there's also Medicare, Medicaid, other private coverage, military, etc. This shows that the medical bills in America are so expensive, or the healthcare in general is so expensive, that most Americans have to rely on an insurance, and most of them can't even begin to afford one, so they either rely on their employer for one or they go without one. There's a small percentage of Americans that can get Medicare and Medicaid, which is provided by the government, but not everyone that can't afford insurance can apply for that. So they're kind of stuck in a loophole in between those. Next. On the contrary, Canada uses a single-payer system that ensures healthcare for all citizens. Canada provides all of their citizens with an insurance. This graph reads that 64.2% of the medical bills are covered by the government, 15.4% are out-of-pocket costs, then 12.4% is private insurance, then there's also other sources and other public sources. So the Canadian government pays at least half of the citizens' medical costs. They make sure that at least half of it is paid off. Then the citizens have to find a way to pay for the rest, but their insurance covers most of their bills. Unlike the United States, where the citizens have to go out, look for an insurance, or look for a way to pay their bills, if they don't apply for their government insurance, which most people don't. Next.
Healthcare has become increasingly prevalent in today's society. The quality of life from a scientific perspective can impact the real quality of one's life and their experiences. The quality of life scientifically amongst North American healthcare systems has been more important. Canada and Mexico provide for a better quality of life compared to the USA. To begin, shown in this image right here, it shows scientific data that people in Canada and Mexico are really happy. Next. The US sources of healthcare coverage prove in this image, and note the populations and emotions for a better quality of life on coverage backing up the claim. Almost every citizen in Canada create a better environment. Healthcare has become increasingly more prevalent scientifically, overall leading to a satisfaction of people in Canada. Next.
As seen by the graph, the United States spends 17% of its GDP on healthcare. This is a large jump compared to the second highest country, Switzerland, which insures its citizens with nationwide healthcare coverage. Finally, we see Canada only spending 10% of its GDP on healthcare. The contrast between the amount spent on healthcare is not proportional to what services are provided to its citizens. It could be concluded that the U.S. healthcare system is flawed as it spends the most on healthcare, however, provides the least amount of services to its citizens. The World Health Organization concludes that the Canadian drug prices are significantly lower than the United States, and the PNPRB reports that the prices are, on average, 40% lower of that of the United States. This greatly impacts quality of life because those who need vital drugs may not be able to receive them. An example of this can be provided by WebMD, where they provide a story of a family who saved over $11,000 traveling to Canada in order to receive insulin for their daughter. This shows how the U.S. does not do enough to protect its citizens who need vital medications. In conclusion, Canada and Mexico's healthcare system provides a better quality of life for its citizens. The United States system does not do enough for those who cannot afford healthcare, as well as having drug costs substantially higher than that of Canada as well as Mexico. Therefore, in conclusion, the Canadian and Mexican healthcare system provides a greater quality of life for its citizens. Any questions?
I do have a question for each of you. All right, here we go. First question, we're going to start with Bella. You're up first. Describe how the content of your team presentation changed as a result of the things you guys talked about.
So at first we started with the idea of healthcare and comparing it. And we started thinking, okay, let's compare North America to Europe. And we realized that that's too big. And we had to be more specific with what places or countries we wanted to compare. So we decided to just compare the countries in North America since they all have a pretty different healthcare system. We had to narrow it down a little bit, but we ended up deciding on that.
All right, next up is Drew. In what ways did you improve your ability to work with a group as a result of this project?
Definitely. Can you repeat the question, please?
Sure. Tell me how you became better as working with a group because of this project.
Definitely. One of the first things we did was read the papers of our like, for example, I read Isabella's paper, so that gave me like some knowledge on like what she was learning, and then from that I was able to like decide what evidence I was going to use to put on my slides. So we kind of like bounce back and forth between like who's going to do what, and then in the end we like put all together our evidence from our papers, and then we made the presentation.
All right, thank you. And Evan, for you, thinking about everyone else's work, which one had the greatest impact on you and why so?
Well, definitely, first of all, Iman, she left the group, but wait, so you're trying to say who had the greatest impact on my work?
On you, yeah, and your understanding of everything.
Well, definitely Drew made everything more clear for me, and I would say Bella cleared things up as well. But most of all, we came together as a team to gather information on things that weren't clear, such as Mexico. We couldn't really find any evidence from Mexico in their healthcare system, so we had to work as a team. But overall, Drew and Bella did a good job impacting my part in the role.